Insomnia. Part 1. There is always new research. There are new ways of classifying insomnia, but the fact is there are 3 basic types in regards to treatment. Primary insomnia, which can be short-term or long-term. Insomnia associated with other sleep disorders, like parasomnia, sleep breathing disorder, or movement disorder. And finally, insomnia associated with other medical conditions. Most people have a general idea of what happens during a sleep study. You spend the night sleeping in a laboratory, all wired up, while doctors run tests. New approaches to testing are likely to take place in the comfort of your own home. Many people's sleep disorders haven't been diagnosed. Research in the future will be to increase and better diagnose existing sleep conditions. More research will be done on the effects of not getting enough sleep. Chronic sleep loss is now recognized as an epidemic in the United States and is getting worse. More people are working at night, binge watching television, becoming dependent on social media and their mobile phones. So while technology is improving research, it's also creating new research topics. Researchers also want to study how sleep deprivation impacts the conditions like heart disease and diabetes. Part 2. Primary insomnia. Primary insomnia is poor quality, inability to fall asleep, get back to sleep, or lack of sleep that lasts for at least a month and isn't attributable to other conditions, genetics, illness, or environmental causes. Primary insomnia creates the inability to function in life due to the sleep disturbance or the fatigue associated with it. The exclusion of common causes of insomnia is required to make the diagnosis of primary insomnia. Medical causes of insomnia include the following: chronic pain, especially from neuropathy, primary sleep disorders including sleep apnea, periodic limb movements, and restless leg syndrome, dyspnea from any cause, pregnancy, or drug use or withdrawal from SSRIs, stimulants, antihistamines, caffeine, diet pills, herbal supplements, and steroids. Psychiatric and/or psychological causes of insomnia include the following: anxiety disorders like panic attacks, generalized anxiety, obsessive compulsive disorder or OCD, substance abuse including alcohol or sedative and hypnotic withdrawal, major life stressors and/or events, and mood disorders including depression or mania. Environmental causes of insomnia can include the following: noise, jet lag or shift work, and a bedroom being either too hot or too cold to sleep in. Symptoms of the following conditions can mimic those of primary insomnia. Substance abuse can cause insomnia during the intoxication phase, during the sustained use phase, and during the withdrawal phase. Short-term insomnia, also called the adjustment insomnia, is usually caused from external issues. It lasts less than 3 weeks, and there may be some sleep state misperception involved, called paradoxal insomnia. Long-term insomnia, also called psychosocial or idiopathic, can last longer than 3 weeks, may or may not have had an external source start. Racing thoughts could be a problem, light sleepers, and paying attention to surroundings. Part 3. Treatment. Non-pharmacologic treatment consists mostly of education and cognitive behavioral therapies. The focus is sleep hygiene, or factors we think perpetuates insomnia. Healthier sleep habits are important. A sleep diary will help determine possible areas for change. That's why we've included a 2-week sleep diary in this program. Changing the associations with sleep in the bedroom and other problems, including removing work and clutter, only going to bed when sleepy. If unable to fall asleep within 20 minutes, we recommend leaving the bed. You can get up and do some relaxing activities such as stretching, reading a book, something that'll help calm you. Avoid taking a nap. Once you get calm and relaxed and you're sleepy, you can go back to bed. Again, relaxing exercises, creating a strong sleep routine in the mornings and the evenings. Self-talk, so if you're telling yourself at night, I have insomnia, I can't sleep, well, guess what? It's going to be true. You can't talk to yourself like that because your body will respond in the same way. So changing that self-talk. And then sleep restriction, so changing the times you go to bed and seeing what works best for you. Sleep restriction therapy involves limiting the amount of time you spend in bed to the actual amount of time you normally spend sleeping. This results in sleep deprivation, which accumulates and causes more rapid level onset or subsequent nights. As sleep improves, you're allowed to gradually increase time in bed by 15 to 30 minutes. You can see why this would be a last resort. Part 4, Sleep Diary. Here are some terms that we will be using in the following slides. TST stands for total sleep time. TIB stands for time in bed. And SE for sleep efficiency. This is your instruction or a formula on how to calculate your sleep time and use your sleep diary. We recommend using the diary for at least 1 to 2 weeks to calculate the total sleep time and get a baseline. Be sure to set your bedtime and wake-up time to approximate the mean for total sleep time. You want to make sure you can get at least an 85% sleep efficiency. To do this, you take your total sleep time and divide it by your time in bed and multiply it by 100% over the next 7 days. The goal is for the total time in bed, TIB, not to be less than 5 hours. According to your baseline, you want to make weekly adjustments. You only want to do 1 change per week. You don't want to overwhelm yourself and make too many changes because then you're not going to know what's working. For sleep efficiency, you're going to take total sleep time divided by time in bed times 100%. Again, you want this to be at least 85% and up to 90% over the next 7 days. Part 5. Insomnia secondary to sleep disorder. Even if the primary disorder is treated, many people still have insomnia. This is a learned behavior that we will need to treat. Follow suggestions for long-term insomnia. Part 6. Insomnia secondary to medical conditions. Many medical conditions, psychological conditions, medications, and environmental factors have the side effects of insomnia. This is to be considered insomnia secondary to a condition. A sleep diary will help determine possible areas for change. Be aware of medication side effects and possible changes in timing of doses. Alcohol can contribute to insomnia. It may allow a person to fall asleep easily, but as it is metabolized in the evening, it causes disrupted sleep. The second half of the night will be fragmented. Part 7, Final Thoughts. Again, make only one change at a time. You need to know what works successfully for you. Always discuss changes that you're making with a physician, especially when changing medications or time you're taking it. If you are the only one in control, so you should continue to keep a sleep log to be able to evaluate how each change has helped you. You are ready for the next module.